I think that at the end of the day, we want to tell the parents and the home caregivers they're not alone when they're discharged. My name is Chantel. My pronouns are she and her, and I'm a connected care nurse at SickKids Hospital. My role as a nurse with Connected Care is pretty awesome. So what we do is we try to get teachings for family caregivers, bringing out their confidence for them to go home, taking care of these medical technologies for their child. For example, we would teach them about tracheostomies, we would teach them about CVLs, G-tubes, NG-tubes, enoxaparin, like sub-Q injections, and we provide that confidence in that family or caregiver to do this independently or just with their nurse to work together as a team so they're comfortable at home taking care of that medical technology. There we go. So as we're going in, so if you noticed, so right here is that guide wire.
Okay.
The purpose of that guide wire is to guide the wire in. Okay? It's harder compared to this one. It's like a noodle, right? Exactly. When a family comes to us, usually they're quite nervous, which is totally normal for a kid going home, for example, with an NG tube. But when they come to the class, we reassess what have they been doing? How comfortable are they? A lot of the times they're not as comfortable, but after understanding the theory into it and actually doing the process, it's not that bad. And at the end of our session, we usually reassessing, how did it feel? And a lot of the times they're like, it's not that bad. And again, just giving that reassurance and that confidence to the families is really, really rewarding. We also try to support home care nurses in the community, taking care of other people's kiddos with those medical technologies and strengthening their knowledge and understanding and just having that confidence to take care of them and take care of that medical technology. I found that teaching was one of my passions. I really found that grasp of teaching, and having that experience teaching U of T nursing students on the floor, on 7B, and on pediatric medicine really opened my eyes to adult teaching, which was really cool. And so having this position at Connected Care, it's literally the merge of all the experience that I've had on the inpatient floor, plus U of T nursing students, adult teaching. It's literally a marriage between that, and it really worked really well for me teaching these families here. What makes SickKids a really great place to work is honestly, it's honestly the people that you work with. Nursing doesn't stop. We're literally here days, nights, weekends, holidays. So if you have those days that are really hard, you can always rely on your SickKids family to understand we're all so close together. We always have, again, someone to rely on, someone to understand what we're going through. That's what kept me here. It's the community, really.